So, John, I think that's us now. I think we've got all our delegates that are signed up. So can I hand over to you and ask you just to talk to us about the sort of current sort of situation, what's likely to happen over the next sort of a few months, there's crystal ball sort of stuff, but what should we be expecting in order that we can plan as best as we possibly are able?
Thanks, Mark. Yes, so you'll probably know that, like most of Yorkshire, had its second wave peak at the end of November, and cases were declining quite considerably over the Christmas period. The new variant, in combination with the additional mingling over Christmas and the festive period, has changed that. And we're starting to see a rise in the community cases, up 40% in the last 7 days. The hospital's fairly steady at the moment. We're about 135 inpatients. At our peak, we were up to about 180 for this second wave. So at the moment, it's a plateau, and we're just nervously waiting to see what's going to happen over the next couple of weeks. The next couple of weeks is going to be a really crucial time, and it is because of that combination of the increased transmissibility of the new variants, but also, people have been mixing a lot more over Christmas, and I think people are a little bit fed up with the social distancing restrictions and getting a little bit fatigued. So all the messages that you're hearing in the media about trying to reinforce the importance of lockdown is going to be really crucial. The big change from when I last talked to you is the success of the vaccines. We have 3 vaccines now licensed, Moderna, Pfizer and AstraZeneca. We're doing our own trial in Bradford, which we hope to get results for in the next couple of weeks. Some of you may be, I know I did see some teachers in the trial clinic.
Right, okay.
Which is a Novavax, which also looks encouraging. And, this is really crucial. This is a little bit of a race against time. It's a race to save lives, it's getting the vaccine out. So this is what the NHS is really trying to pivot and focus on. So we're coping with the inpatients at the hospital. At the moment, the hospital's doing okay. Today, it's pretty touch and go just because of the snow. I know the Yorkshire Ambulance Service has called a major incident because of the combination of COVID cases and snow on the roads. We're struggling with getting staff into the hospital and staff home, as Mark knows, so he's making his bed in the corner down there. So the big challenge now is rolling the vaccine out, and these are being rolled out. And originally, the Pfizer one required this -70 freezer storage, which did limit the number of hubs that we could do to 4 or 5. But with the Oxford vaccine, which we started to roll out in Airedale, and which will go into the care homes fairly soon, that does change everything. And we've moved from mid-December to just having a few hundred a day to we will be on to by Monday week, we're hoping to get 55,000 jabs a week, which is quite phenomenal, really. So, with a population of 550,000, doesn't take much maths to work out that potentially in 3 or 4 months we could have vaccinated everybody. And I know the teachers should be front of the queue. That's what I think as well. So hopefully we are going to get to that, and everybody will be available for being offered the vaccine. I can't tell you anything more than that in terms of prioritization. The prioritization is given to us nationally, and it is very much age related, because this is stopping people dying. The people who are most at risk of dying are over 80-year-olds, over 70-year-olds, and so on. And the frontline workers in the healthcare and social care worlds, I think teachers should be included in that. But that's not my decision. But it won't be long, I don't think, before this is rolled out. So there's been a delay in the second doses. I think it's quite understandable. This is about coverage and immunity, to get as many people covered and immune as possible. And the marginal benefit of the second dose can probably wait. One of the key features that we're trying to address at the moment is vaccine hesitancy. And we've been doing work in Bourne and Bradford with our families to try and understand this a bit more. And I think there's probably more vaccine hesitancy in Bradford than in some other places. Our survey work has shown that about 30% of the population are up for this. About 10% are committed anti-vaxxers, and it's going to be very difficult to persuade them. And about 60% are undecided, unsure, and it's these that we need to work on. And I think over time, I think people will come quickly to terms with it. So I think most of these people will start accepting the vaccine. That herd immunity across the city, across the district, is really important. You know, this is really the race against time. But it's something that everybody, all of us on this call or on this webinar need to try and address and counter the fake news that's going on. You know, some of the concerns are quite genuine, and everybody here will be concerned about a vaccine that's been rolled out so quickly. Maurice Hilleman, the famous vaccinologist who developed sort of 30 or 40 vaccines, used to say that he only breathed a sigh of relief when he gave his 3 millionth vaccine. But we will have exceeded this target in the UK alone by now. So the vaccines seem pretty safe. The scrutiny on them is intense. Some people don't want to get the vaccine because they think they're young and healthy and not bothered about COVID. And I think it's about persuading people that it's not just about them, it's about their families, it's about their parents and grandparents. And then the misinformation that you'll all have seen, WhatsApp videos going around is very prevalent. And what we're finding is that it tends to have a stickiness which is greater in minority ethnic communities and South Asian communities and East European communities, greater than the white British communities. But there's a strong social gradient here as well. So that in the more deprived communities, the misinformation is also sticking more strongly than it would do normally. So lots of strategies to try and counter this. I think time is on. I think people will come around to it quickly as they get offered it. I think there's a lot of stuff that we need to do in terms of role modeling and getting faith leaders and community leaders coming forward for the jab. And I think there's stuff around countering the misinformation, the misinfodemic that's going around. And that's in getting the messages in different languages and appropriately. And then a sort of more grassroots approach. And I think every one of us needs to be an advocate for this. This really is our way out of this terrible, terrible situation. So the quicker we get everybody vaccinated, the quicker we're going to get back to normal. I don't really have. I'm happy to take any questions, Mark, but I don't really have any other updates apart from that.
That's brilliant. Thanks, John. So if I can ask people to put sort of questions in the sort of a chat, if they have any, then we'll read those out to sort of John. I'm not seeing Helen on the line. We do know she was really sort of struggling with the sort of snow and having sort of personal problems. So I think what we'll do is actually hand over to Duncan now, if that's all right, sort of Duncan. And if Helen comes on, then we'll hear from Helen. We do know that Helen was wanting just to shine a light on the mental health issues that are experienced by children and young people from a health service perspective, but I guess none of that's going to be news to people within the sort of school system. And it's obviously something that we're all going to need to work hard together to tackle. As John sort of said, it's going to be a major focus for Age of Wonder. So if Helen comes on later, it'll be great to hear from her. Obviously, Ruth will be picking up some of these issues around mental health as well. But if I hand over to Duncan now, and as I say, do please put questions in the chat. I see there's some chat questions there already, but I think they're probably questions best directed towards Duncan rather than John right now. So Duncan.
Yeah. And apologies, I didn't know Duncan was here, so I've probably been stealing some of his thunder and getting it wrong as well, Duncan. So you can correct me on any of the numbers of cases in the community.
Right, just checking I wasn't on mute. I do that every time. So first of all, Happy New Year to all you head teachers. It's good to see you again. I hope you had some sort of a break over Christmas and New Year. Even though that we were getting U-turns and new government announcements every 2 days, I hope dearly that you got some sort of respite with you with your families. So what I want to do today is that I'll briefly cover the situation in Bradford. John's already touched on that, and all your data is correct, John, so I can support you on that. Just give you a little bit of information about how it varies across the district. I'll come to lateral flow testing within schools because I know that there'll be a lot of questions there, and then some practical issues around PPE, how we want to report test this year, and so on. Because I know, although the national the national sort of narrative is that schools are shut, they're very much not shut, and we know that over the district about 10 or 15% of children are still in school, and that goes up to 40% in some, because we've got this expanded definition of key workers and vulnerable children, and I know that is proving very difficult for some of you. I'll try and answer all the questions. I haven't got one of my education team colleagues on the line with me today, so I'll try and answer as many questions as they come through, and if there isn't any, if there's some that I can't answer, we'll make sure we get answers back to you tomorrow. So we'll just start off by telling you what's happening in the district. So John's right in the sense that the rate of increase it is quite worrying. So it's about 30%. It's going up by about 30% a week. But the one advantage that we do have in Bradford this time is, as opposed to the other two major lockdowns, Bradford's starting near the bottom of the league table in terms of the country. So our rate is 280 per 100,000. So just to give you some comparisons, the overall England rate is 650 per 100,000, and then some of those boroughs in London are over 1,600 per 100,000. So we're quite near the bottom of the pack. So it gives us a really good opportunity in Bradford to flatten that curve, starting out at a good point. And what we're seeing at the moment is that exponential rise in London and the southeast is starting to go down again. So the lockdown is starting to have an impact. And what we've seen in Bradford over the last few days is that rate of increase has started to plateau. So some good news in terms of hopefully we'll be moving into a better place in Bradford. In terms of school-age children, that's the age group with the lowest COVID infection rate at the moment. So the 0 to 15 has got a much lower rate. It's about, I think it's about 100 per 100,000. So it's much lower than the overall rate. The one worrying thing that we've got is where it's really shooting up is the over 60s. So, and that's, obviously in terms of hospitalisation, that's a big worry for us. But it's the young adults that have got the highest rates and children that have got the lowest rates at the moment. The other thing is, in terms of COVID deaths, we usually see about a 2 or 3 week gap between infections rising and deaths rising. We're still getting between 20 and 30 COVID deaths a week in Bradford. So it's just a constant reminder that this is a potentially, critical illness. So it's really, really difficult. So anything that we can do to break those chains of infection within schools can break and stop those household clusters going back into the community. So your leadership role, even though it's really difficult at the moment, is still really important in all that. The other thing that you might have heard about is a 3-metre rule. So we're imposing a 3-metre rule within council buildings, but it's easy for us to do that. And I recognise that it's really difficult to do that in schools. So the 2-metre rule, I'd say that is, in terms of your risk assessments and the way that you work in school, if you can still really focus on that 2-metre rule, in corridors, in and out of the buildings and so on, that would be really, really appreciated. But we recognise that a 3-metre rule just might be impossible within schools at the moment. So in terms of the areas with the highest infection rates in Bradford, what we saw before this current rise is that it went down really quite low in Bradford district, and it was some of the more outlying areas, places like Ilkley and Wharfdale, that had the highest rates. A lot of that was to do with care home outbreaks rather than community infections. And what we've seen since is, as the rate has started to rise again, the hotspots have gone back into central Bradford again. So in terms of the 10 wards across the district with the highest areas, the highest rates, we've got Royds, Heaton, Wick. I'll send all this out in an update tomorrow as well, so don't worry about having to write it down. So Royds, Heaton, Wick, Bolton and Undercliff, Wibsey, Windhill and Rose, Tollett, Clayton, and Manningham have got high rates, and Feldon is probably the area that sticks out as a little bit more outline that's got a high rate as well, but it is rising gradually right across the district. So that's one message. The other thing that we get asked a lot about in public health is this new variant, and John touched on this, but there's more and more emerging evidence that the new variant, although it is more infectious, and we think it's probably between 50 and 70% more infectious, it's not more dangerous. And we think that the vaccine provides good coverage for the new variant at the moment. The other thing that's been in the news that some of you might have seen is that the new variant's more likely to infect children. So that's not true. I think where that's come from is that if you look at where the new variant emerged, and it emerged in the southeast of England during October and November, kids were really the only group that were mixing. So there was a big takeoff in infection rates in schools, and I think that's led to this perception that more children are likely to get the new variant infection. So it isn't true. It's not more dangerous for children. They're just as likely to get the new variant as adults. And I think the focus is just to not get too sidetracked by the new variant, and just focus on the control measures within schools. The other thing as well is that some of your parents might be reading about this South African variant. Again, that's more infectious, but there's only been a couple of cases detected in the country so far, and all of the cases detected have got links and travel links back to South Africa. So as far as we know, that hasn't had an impact on the UK yet. So that's a sort of overview of the district. So the next area that I'll try and cover is I'm sure your favourite topic of lateral flow tests. So this is a really fast-moving situation. The council's position really on this is that we want to support you in the delivery of testing within schools, but we want to do this in a way that enhances the risk assessments and enhances all the procedures that we've put in schools already, and enhances the system that we set up last term for reporting COVID cases. So we don't want it to be a distraction from all the basic stuff around social distancing, hands, masks, let us know about cases. And we completely realise that setting basically a medical testing facility up in a secondary school is something that you'll have never had to do before. And so there's lots of difficulties with that. So some schools have started to do this already. I know some of the academy chains are moving forward quite quickly in this. There's one of the special schools, and there's one of the secondary schools that we're in really close contact with to try and get best learning and practice for this to feed back to you in terms of making that decision. The other thing that's obviously coming over the horizon really quickly is home testing. And businesses are starting to use home testing kits now, the lateral flow testing kits. And nurses have been using them for weeks. So that's quite a well-established process, and lateral flow tests have now been licensed for home use. So I think that's probably the best option actually for staff testing, because I know you're getting some of these kits that are starting to be delivered to schools now. So I think our favoured option for staff, and we'll start to give you more information on this, is to set up home testing for staff. Secondly, we'll support you in any way that we can, should you take the decision to set up testing facilities within schools for staff in themselves. And although the government is expecting you to do that, it is optional for schools whether they take that approach. And it's also optional for parents whether they opt in or out of those testing facilities. So that's the second thing. And we're developing a piece of guidance at the moment that will hopefully get to you very soon, that will set out a timetable and give you the sort of support that you need to set up testing facilities within schools if you take that approach. So that's the second thing. And then the third one is around serial testing. And this is where I got sent a question before we started about serial testing. So serial testing is really a part of the testing programme whereby if you get a positive case within your school, either in a staff member or a child, rather than excluding that bubble for 10 days for self-isolation, they have the option for serial testing. So it's daily testing using a lateral flow test. Now, in public health, and we're supported by our education colleagues in the council, we don't support this as a policy. This is really the only area where we're going perhaps a little bit off what the government is expecting. And the reasons why we don't support serial testing, I'll go through now. So the first thing is it seems to contradict COVID law. COVID law states that if you get a positive test, you need to self-isolate for 10 days. So keeping bubbles in school that have been potentially exposed seems to go against that. The second one, probably the main thing, is that lateral flow tests were designed as a mass screening tool. They were not designed as a way of testing people and then releasing them back into workplaces. And the Liverpool pilot showed us that lateral flow tests miss about 50% of cases. So what we're potentially doing is, rather than excluding children for 10 days, we're keeping them in classrooms with COVID. And because of that, we don't think it's a good idea. The next thing is in terms of it introduces some really difficult operational challenges for children, for schools. So if you imagine you've got 3 cases, you've identified 100 close contacts, you're suddenly going to have to scale up that testing operation so those 100 students get tested every single day. So if you think you can do that, fine, but the feedback that I'm getting from schools is that scaling up and down of testing might be quite operationally difficult. And then the final thing is, because it's opt-in from parents, you're going to split classes to test, not test. So that could be quite difficult to explain to kids. It could be quite divisive within classrooms. And also it's going to be quite administratively difficult as well. So with those principles in mind, we're supporting testing for teachers. We support you to test children on a weekly basis if that's the way you want to go, but we wouldn't support serial testing. And that's an approach that is supported within Coaldale, and it's supported by other directors of public health across West Yorkshire. So just wanted to try and give you a bit of guidance on that. The other thing that's come along is there's obviously the announcement from the government about expanding home testing for key workers such as teachers to primary schools as well, which we completely support. I think although the infection rates are lower in preschool and primary school age children, I think giving teachers that extra sense of surety and assurance around testing before they go to school would be a good idea. So that's a sort of summary. There was another question about whether lateral flow tests, you should take them within 90 days of a positive PCR test. You're not supposed to take them because you still might have the virus in your body, so it might give a false positive result. Our advice is to not, if you've got symptoms of COVID again, you need to go home and self-isolate for 10 days. And then if you've got any clinical worries about that, the guidance is to get in touch with your GP, and they'll be able to advise you whether you have another test or not. But to keep having new lateral flow tests every 10 days is not advised. There needs to be a 90-day gap. So that's sort of summary of testing. But just to say, I know you need something putting down in paper. We are working as quickly as we can within the council to get something to you on that. So we'll send that through as soon as we can. Okay. So the next thing, set of questions that we've had through is how you dispose of lateral flow tests. Whether this is clinical waste or not. I know that some of you will have been contacted by clinical waste disposal companies. What we'd advise you to do is, if you've already got arrangements for disposal of PPE and so on as clinical waste, use those arrangements to also dispose of your lateral flow test kits, whether they're positive or negative. And again, this is where you're getting contradictory advice. We're getting contradictory advice as well. So it's really difficult. You just have to make a decision at a local level. And lateral flow tests have been licensed for home. The guidance with home is to put them in a bin and just use disposal waste. There's testing centres now that are using household waste disposal, domestic waste disposal for lateral flow test kits. So what I would advise you to do is use the same procedure that you've got for disposing of PPE within schools. So double bag it up, leave it for 72 hours in a safe place, and then use your usual waste disposal. If we get any more updated guidance, we'll let you know. And I realise that some of the guidance that you've got through to schools calls it clinical waste. As far as we're concerned, it's low risk health waste. So dispose of them as you do with PPE. So that's one thing. But all I can say is, sometimes I know as much as you. I don't get any advance warning of the government decisions, so we'll just sort of try and keep it on that. So that was that one. Bear with me. There's quite a lot to get through this time. So I'll try and sort of finish up quite quickly. The next thing is about reporting of cases. So to date, we really do appreciate the reporting on the council web forms that you do for positive cases. Although it may seem like all that information goes into a bit of a black hole, it really doesn't. So we monitor that. We use it for getting key messages back into schools for some of the information that we get on those web forms, and we can use it to respond as quickly as we can. So please report a positive LFT test. So if you get a positive COVID via the new testing kits, please report that through as you've previously reported through. We want to know about those positives as soon as possible, and then we can get that response. If you just let us know when you report through to the council whether it's a positive lateral flow test, that would be really helpful. And the reason why we're saying that is that although there's some problems with the testing in terms of they miss cases, when they do test positive, they've got a very high positive predictive value. So basically what that means is if you get a positive lateral flow test, it probably will turn out to be positive. So we do need to know about that. And it's likely that the government might change the guidance in the next week as well into you don't need a confirmatory PCR test, so that'll change. So the LFT test might actually just be the gold standard from now on as well. So let us know about all those positives. So that's the last thing around COVID. The only other things that I'll let you know about is just quickly about some of the wellbeing developments. So I've put the self-help booklet on the Bradford Schools online webpage, and I'll send the link to you tomorrow as well. What we've tried to do is put everything together in one place, so it covers it's got all the phone numbers in around domestic violence, access to social care, things like that, mental health for parents. It's got all the financial phone numbers in, websites around the furlough scheme, access to financial support, all those sorts of things as well. It's all been put together in a really clear document. So it's worth having a few of those printed off at school because it'll have all those phone numbers to support parents during COVID and so on, and give them those numbers. And it's really, really important. One of the big barriers to testing that we're still getting back is people are just worried to do it because they just can't afford to give up their work if they're still working. So have a look through that booklet and make sure that you're familiar with what's in there. So that's one thing. And then just a couple of things to really quickly let you know about. The National Child Measurement Programme for reception in Year 6 has been postponed until the summer term. So if children start to come back into primary schools, we'll try and catch up with that in the summer term. So I'd really appreciate your support with that, and the school nursing teams will be in contact. And then the other thing is that I know some of you signed up for the lifestyle survey, which we do every 3 years. I've tried and failed now 3 times to get this survey off the go this year, and every time I've been thwarted by COVID. The first time there was a lockdown, the middle time there was all that disruption you were dealing with last term, and then this time we've got another lockdown. So rather than trying again for the 4th time, we're going to postpone that until schools are more back in, back in a little bit more state of normality. So just to let you know, there are a few schools that have taken part in that survey already, and you'll still get your school-based reports on that lifestyle stuff. But there's lots of work going on with John Wright and Born in Bradford projects as well, about really trying to get that intelligence about how kids are coping as they go through COVID. So we'll continue to work with John around that as well, so we can try and get that information. So that's the last thing. So sort of stay safe. Really, really appreciate the fact that schools are open and you've got massive challenges. We'll keep the information coming through to you on the lateral flow testing and try and keep you as up to date as possible. But please keep all the information and the positive cases and the reporting coming through to us, and we'll support you as much as we can. Okay, I'll leave it there, Mark. I'll try and answer any questions, and I'll take any back that I can't.
That's fantastic. Thank you, Duncan. So there are some questions coming up in the sort of a chat. John, there's a question to you, and I know you've sort of answered it to me, but could you just sort of speak to the group? So the question's about the impact of vaccination on transmission.
Okay, so there's a technical aspect to this. When you give the vaccine, you're doing it intramuscularly, whereas when you get infected with the virus, you breathe it in, and so your respiratory tract develops antibodies, IgA antibodies, which protect against future infection. When you inject it into your muscle, you get a different type of antibody which protects against systemic effects of COVID-19, and so the illness that you see that's bringing people into hospital. But we're not sure if it stops transmission, and that's one of the big questions. And so there's a biological plausibility that it won't stop transmission. So this is all going to be followed up as we vaccinate at speed. We'll be able to find out, we'll be able to monitor people and see whether people are transmitting. We know there's a siren study that some people are seeing in the news today of healthcare workers, people who've been infected twice. So we know that even within 5-6 months, you can get infected again. 10% of people had secondary infections. Seems to, and they may be asymptomatic, but you can still transmit. So the advice is in summary, Mark, is that if you are vaccinated and you're in contact with somebody, you still need to isolate and you can still transmit.
That's great. Thanks, John. Duncan, I think this question is one for you. The question is, as we're getting training on Monday as primaries, are we suggesting home testing for staff as the best option?
Yeah, I think you've got to think about as a school what's the best option for you. From my perspective, home testing appears to be the best option for me. It would seem easier to give staff home testing kits, fairly easy to do at home, than set up a testing centre in school. But if you think it's easier to set up a testing centre in school and you want to manage it from there, that you've got the manual to be able to do that. So I think that's your choice, really. I think what we'll see over the next month is the government increasingly giving the message that they want key workers to use home testing kits. I think that will become more of the norm rather than setting up testing centres in settings such as schools and businesses. So it's up to you to sort of weigh through what is the best option for you, and then do what's operationally easiest.
So there is a related question here, Duncan, which is, will you support primary schools who want to test staff?
Yes, I think we will. I think you've already had support from the government on that. I think although the infection rates are lower in primary, I think what we found out through COVID is that schools mirror what's going on in the community rather than the other way around. So if you've got high levels in your community and your primary school is in the hotspot of COVID, you are likely to get cases in schools. So I think it's a really good idea to introduce in primary schools as well.
Thanks, Duncan. I think a question perhaps for you and John is, early year settings are asked to stay open. Can you give us a clinical view on this and the potential risk to early year staff?
John might have something extra to say on the clinical aspects of it. I think the clinical risk is low. We've said that before, that if you look across childhood age groups, the infection rates in young children, and this isn't from known cases, this is from serology, is just much lower. So I think the risk is lower for those staff, but whether they're open or not is an entirely different question, because you may have some asymptomatic transmission, and also what we've found with school staff getting positive with COVID is very often it's between staff transmission in staff rooms and things like that that's occurring, rather than child to adult transmission. So personally, I think it's a good idea at the moment, because we've got vaccination coming along. We need to suppress the virus as much as possible. And we've had this conversation around religious settings as well. I think we just need to reduce interaction as much as possible. So I think there's a strong argument for closing early year settings, closing religious gatherings and so on, weathering it out for the next month, but this has to come with financial and emotional support as well. And I think we just have to do that. I really do understand concerns about staff. I don't think there's a big clinical risk for those staff, but I think in terms of the country and trying to suppress a third wave, it might be a good national policy to close nurseries as well.
Thanks, Duncan. John, any thoughts?
No, I completely agree with Duncan, actually. Part of our frustrations is the compromises that we are told to enforce, but actually common sense suggests that at the peak of transmission in the community that we should be stopping as many interactions as we can.
Okay, thanks both. Another question, and again, I think probably for you, Duncan, is if a member of staff has recently had COVID and is now better and able to be back at work, should they still be tested weekly at school?
Yes. It goes back to my previous point about the siren study, Mark, and you can still transmit, you can still be infected again, so you still need to be tested.
And the related question is does the main test cancel out a positive lateral flow test?
At the moment, in terms of cancel it out, I'm assuming that means a different result. So if you're positive for LFT and then negative for PCR, that is the gold standard at the moment. So I would say that does trump a lateral flow test. But we are going to move towards a situation where I don't think we're going to be requiring the public to get a confirmatory PCR. So you'll just have to trust the result of the lateral flow test. But with any sort of test, there's false positives and false negatives. You know, all the sort of screening that we do, all the testing we do, there's always issues with that. So I'm afraid, I know it's really, really frustrating because you could be going home for 10 days when you don't need to, but that's just one of the burdens that we have to bear at the moment.
And again, it gets back to that point, we've just got to weather this out. This is not the time to take any risks. Brilliant. Thank you so much, Duncan. Thank you so much, John. Thanks appearing in this chat. That's been really informative, really useful. If people do have further questions, please just put them in the chat. There has been quite a lot of disruption, so Helen hasn't managed to get online. There is, as John said, wide scale disruption, across Bradford. I know some of the schools have been affected, and some of our heads have been affected by the snow. So that actually puts us slightly ahead of schedule. So Ruth, if it's all right, I'll hand over to you now. Helen, as I said, was going to be talking about the mental health issues playing out that are becoming very, very relevant within our paediatric services in the hospital, and I guess it's something you're picking up as well. So if you could perhaps talk about these issues, that would be fantastic.
Yeah, for sure. Thanks, Mark. Katie, have you got some slides for me, please? Marvellous. Thank you very much. Okay, so what I plan to do today was just to give you a quick update on where we are with wellbeing support from the education psychology team. And I think when I spoke to you last time, there were two elements that we were looking at. And so they've now moved on quite a pace, and there's a clear strategy. And so if you just go to the next slide, Katie, we can talk through those. So the first one that we were talking about was about student support. So this is about students who are experiencing difficulties that they didn't have before, that we are putting down to the emotional impact of COVID-19. And so as you'll be aware, we set up this education-based emotional wellbeing practitioner team. So the update is, and I think you've probably read this on Bradford Schools Online, is this team is now in place. And so we've got a team leader and 4 wellbeing practitioners who are seated within the educational psychology team, and their sole purpose is to work with students in school, 0 to 25, who are struggling due to COVID-19. And so what we're trying to differentiate is young people where they actually had social, emotional, and mental health difficulties in the first place, and students where it's something that's come up and wasn't a concern before, but is in response to COVID. And so that's the focus point for it. The team's funded by COVID recovery grants, so there is no cost to this. And one of the questions that I was asked last time was about, what about if you're, I think it was about independent schools. I checked that out, and it is just maintained schools and academies and free schools. It's not independent schools able to access that. So what the education and emotional wellbeing practitioners will do is that they will work with either individuals or with small groups of children who've got mild to moderate difficulties, and what they'll be doing is going through a range of interventions depending on what the child needs to look at supporting their emotional development, hopefully to bring them back to some sort of equilibrium so that they can then progress and carry on, and they won't then escalate through the mental health services. And so if we can just go through the next slide, Katie. So on Bradford Schools Online, either on the news page or on the educational psychology page, there's a whole section on the education emotional wellbeing practitioners team. And so particularly if you go to educational psychology on the left-hand menu and then education emotional wellbeing practitioners, you can access the referral pathway and the referral forms there. And if Katie sends these slides out after, I think there's a hyperlink in there that should take you straight through to it. Once we've got the referral, that will then be triaged by the practitioners and decision made about next steps. We're aiming for a 5 working day turnaround on those referrals, so fingers crossed we'll be able to keep to that. Depending on the outcome of that referral, either you'll be offered an appointment where there will be an initial assessment carried out and then an intervention delivered on the basis of that, or if it's felt that that referral isn't appropriate for whatever reason, you'll be given guidance on where to go next, what next steps are. And in terms of things have got more complicated again with the current lockdown, because we were thinking that these practitioners would be working in schools. At the minute, we're not working in schools, but we're working through remote means. So at the minute, any appointments will be online and the interventions will be delivered online, but hopefully we'll be back in school as soon as we're able to. So there's an email for you at the bottom there. If you've got any questions about that or that team, you can either email or you can make a referral directly, and the pathway links there. So next slide, Katie, please. And the other thing that we talked about last time was about support for staff. And so what the offer is from the educational psychology team is around supporting whole staff well-being. So I think there's lots of different offers there for head teachers at the minute through the swoosh that Mark's talked about last time. And the element that the educational psychologists are picking up is where there's been identified that there's a number of staff within school that are suffering with their well-being because of COVID. And so the way that program is going to be structured is that we're going to be hosting a webinar for school leaders. It'll either be a live online webinar or it'll be a pre-recorded presentation that you can access. And that will talk you through some of the basic stuff that lots of you are already doing, but some of you maybe just need to double check whether there are other things you could be doing. And then it will also take you through a program called PERMA, which is a program which really works on supporting emotional well-being. It's a really well evidenced program. Linked to that, there'll be 5 bite-sized PERMA videos that you can use with staff if that's required to help them go through this process of evaluating their own well-being and how they might make changes with that. There's an audit link to that which can be used in school, and we'll also be able to offer online support for you as head teachers drafting a PERMA action plan if that's what you feel you need to do. So there will be online sessions, the pre-recorded sessions, pre-recorded training, and there'll also be some consultations if you want to do that. I know there's a couple of schools have already contacted me about picking up on that. So they will all be bookable on Skills for Bradford. Again, it's funded via COVID recovery grant, so there is no cost for this at this point in time. So there you go. I think that's the end of that, Katie. There's nothing else. Oh, there you go. There's my contact details. So if you want to contact me about any of that, you can do. That's the end of that bit. The only other bit that I was going to add, listening to Duncan and the other guys before, was about the mental health champions. So mental health champions are still working and delivering a lot of work with in-school mental health champions, but they're also doing a lot of work with parents as well. So this term and last term as well, they're doing emotional well-being workshops for parents around elements that, I don't know whether you're aware, but we've done an audit with mental health champions around children and young people's mental health, and we're repeating that every half term and building up a picture of what things are looking like in schools, and we're using that to drive the training that we're delivering for the mental health champions themselves and also for parents. And so there's a series of parent workshops coming up, and I think at the minute it's about the ones that are just about to be delivered around supporting children's emotional well-being at home for issues around children feeling that they're not able to access the work, or they're not able to make progress with their work, because that's something that came up in the last audit. So if you're not aware of that, check out with your mental health champion, check out on Bradford Schools Online, because it's always on there. We put all the information on there. Thanks, that's the end from me. Thank you very much.
Fantastic. Thanks so much, Ruth, as always. So questions for Ruth can go in the sort of chat, but some really great resources. As always, we'll circulate all of these materials around, so you don't need to worry about sort of desperately scribbling things down. So I think that sort of segues really nicely into our next item, which is all around sort of a swoosh. So if I can hand over to Christian and Alex to talk us through where we're at with that initiative.
Hi everybody, it's Chris here. Can I ask Katie to share the slides that I've got prepared? There's not so many. Okay, so I'm here to talk this evening to catch up everybody with the progress that's been made around the swoosh offer, the school staff welfare support scheme, and this is a fantastic example, I think, of how the city is working together, and particularly this is about a connection that's been built, an agreed plan of action that's been delivered between the local authority, between the school sector, between CCG and the local authority. It arose, the swoosh offer, the listening and support service for senior education leaders, teachers and school staff. It arose because of meetings that happened last term, previous COVID webinars, and we listened to what you had to say. You were very concerned, not only about, looking after each other school leaders, but also school leaders within your school and teachers and the full team of staff that work within the education system. You were concerned about their mental health. We're concerned about children's mental health, but we need to look after ourselves as well. So as a result of this, you asked for support to be provided for school leaders, teachers, and the full range of people who work in our schools. So can we just move on to the second slide, please, Katie? And I'm just going to walk you through this as a recap. And I know that there are some new people on the call today. There are 4 key elements to the support that's being provided for school. The strategic educational wellbeing support for school leaders provided by the educational psychology team has already been well described by Ruth, and that's column 4 there. But let me spend a little bit of time just to walk you through what's either on offer or soon to be on offer. The first column there, the quick access to support for school leaders, to try to clear away some of the complexity and some of the guidance that comes out, which soon goes out of date. We are dedicating and creating a space for the online storage of the most up-to-date public health, DfE, local authority, and NHS guidance. So the kind of things that have been talked about today, you'll be able to reach for in one place. And this place, we're looking to host this on BS, so will be also a place where head teachers can communicate with each other about issues related to COVID. They may be, stuff that sits within the medical sphere, or they might just be around school practice. There might be things that need to be done that have been put on the back burner. You might have a question about Key Stage 2 assessments, which just might want to be put there just because you want to be able to ask somebody. And that peer-to-peer message board will sit there as well. Not only a single place for you to be able to access information, but a single place for you to be able to message each other. That will also have the capacity to be able to host webinars. And I've managed to secure some funding today, and it's an ask out to everybody on the call today. If you are a school leader who would like to host a webinar and have a topic in mind, I have a small amount of funding to be able to support you to be able to do that. We've got space for probably about 10 or 15 weekly webinars. I'm not expecting you to be the expert on your particular topic, but you may have determined that there's something that needs to be talked about, that you want to explore with some other head teachers, answers to a common problem. Now, if you would like to suggest things to me and put yourself forward as somebody who'd like to host one of those webinar, very low stakes events these, it's just about gathering together as you might normally do on a Zoom, please get in touch with me about that. The second column there is about access to dedicated counselling offer for school leaders. Now, we've got sufficient funding so far to fund about 100 places to access 6 talking therapy sessions. But I want to say, even though I'm talking about 100 places there, it can be more than that. So I don't want people to kind of like factor in a kind of equation. We've got 100 places here, there are 200 schools in Bradford, so I probably only need to put forward somebody who's really, really concerning me. It's not about that. If you've got a staff who you think would benefit from talking to somebody, or if you would like to talk to somebody yourself, go forward and make good use of this service. If we run out of the places, if we run out of the capacity for the current funding to be able to support that, then we will provide some more. This messaging service involves a simple phone line with a weekend and evening availability to be able to provide support. Make good use of it. You know, it is for me, sound like this is platitudes to a certain extent, but it is, you know, it is a strong thing to do, to say that you would like to have some support. These are unprecedented circumstances we're sitting in at the moment. It is like nothing else I've experienced in my career, and it is not surprising that you or your colleagues might need somebody to talk through some of the challenges that they're facing. Even if you're a strong, powerful, really resilient leader, this is the most challenging time of your educational career. So that second strand there on the access to counselling offer, that's up and running at the moment, and it's ready to be accessed at the moment for school leaders, not just for senior school leaders, head teachers, and other members of your senior team. Refer yourselves, suggest to colleagues that this is something that they might want to consider. It is confidential. And the third strand there is about the wider offer of support for all staff who work in your school. And this will come online over this half term. We're wanting the whole of this package to be ready to be delivered and ready to run by the end of February. So there are 4 strands there, which are part of the swoosh offer. Slide 3, please, Katie. Okay, I'm going to hand over to Alex, really, my colleague and friend from the CCG. This is the flyer that you've got already if you've attended previous webinars. We will mail this out. But Alex, if you'd just like to talk through the pathway of support, give a little bit of your perspective, and then talk about some of the impact that we've had so far and some of the, you know, how popular the service has been.
Yeah, no problem. So just to reiterate what Christian said about the counselling offer, just before you get to the counselling offer, there's a bit of a wellbeing check for you. So the organisation is offering just an hour consultation with you on the phone, talk through anything that's going on for you, and then advising what the best pathway would be for you. So at the moment, obviously, we've got the counselling support, we've got some CBT support, we have some wider mental health support as well, text message counselling if you feel that that's appropriate. So that they'll advise you on what the best thing is for you at that point. Just to reiterate, it is for you. You know, it's about you. It could be anything to do with school, anything to do with home, just anything that's going on for you at the moment. Just to get it off your chest and just to talk to somebody about it. We have had a really good intake so far. So this started in December, I think mid-December, and we've had 28 referrals in so far already. 19 from primary schools, 9 from secondary schools, and so 28 senior leaders have had a wellbeing check. 17 of them have been referred into counselling or therapy. 6 of them have been referred into other mental health services, and 5 of them felt that the hour wellbeing check was enough for them. You know, they got something off the chest and they didn't feel they wanted anything else. There has been more referrals this week as well, so it is being taken up. So I'd really recommend you use the service if you feel that it could be beneficial to you. When the messaging service is set up and the peer board is set up, you know, we'll be encouraging staff to to attend like the weekly droppings, the weekly health check droppings that we'll be doing, you know, peer-to-peer led. You know, there'll be specific ones for primary or secondary or mixed if you want, but it's just all about you just getting together and talking through what's going on for you personally or professionally. So, you know, I can't stress how important this is for everybody, because it must be really difficult at the moment with the ever-changing landscape of everything.
Okay, if you just move through, Katie, to the next slide on this one. That's just what Alex was talking about there. We've had, as of a week ago, 28 referrals for a well-being check, 19 primary, 9 secondary, 17 referred on to counselling and therapy, and 6 not needing, 6 referred on to other services, and 5 not needing anything else. I think it's really good that this offer is here. If we use all the spaces up, we will get more. Do not ration your access to the support that's available. These are unprecedented times.
And
Next
just
slide.
one other thing to add, sorry, everyone, it's completely anonymous, this service as well, completely anonymous.
The last slide from us, please, Katie. Right, so to be really clear, the helpline is available. There is a West Yorkshire-wide helpline. This is all on the swoosh leaflet. The support for school leaders is ready to go. Anyway, it is being accessed now. Educational psychology team support able to be accessed now. By February 2021, the COVID document repository, the peer-to-peer message board, and the space for mini webinars by February 2021. At our next meeting in February, the next COVID webinar will give you more details on those. And the wider mental wellbeing support for all school staff in terms of the courses and the taught sessions and the other things like that, they will be available in February. They are already able to access a mental health support telephone line. So really quick progress has been made through this by the CCG, working with the NHS, local authority in the school sector. We have achieved an awful lot very quickly with this, and we are meeting a need. I don't know whether, you know, supporting 30 colleagues at the moment is a news to celebrate. It is both, you know, an indication of the times we're in, and therefore challenging news, but we are meeting the need that there is out there. So I think that is something that we can feel very happy about, and that we're doing the right thing for ourselves and for our colleagues. I'm going to hand back to Mark now, but thank you for the, just one more thing I'm going to use the opportunity to talk about now, and it's the last thing here really. Recently, I've managed to secure funding. It's not with regard to mental health support in particular, but I've managed to secure some funding from the Bradford OA team to make the 50 things to do before your 5 resource pack available for free to all schools, all primary schools and early years schools or nursery schools in Bradford. So I'll put my contact details in and those of my colleague Rachel Dennis into the chat. Resources for those schools who have not yet launched 50 things and want to use this as an approach to support home learning for young children during the COVID pandemic. Or if you have already launched, and it's about half Bradford schools who have, and you want some more resources, to get in contact with me, my colleague Rachel, and we'll provide them to you for free. But I'll pass back to Mark now. Thank you.
Thank you, Christian. Thank you, Alex. Thank you just for presenting the offer that's available, but a massive thank you to you and the team, Ruth, Katie, Catherine, for your incredibly hard work in getting this set up. I think we can celebrate the fact that we're supporting each other through this sort of at a time, while commiserating at just the dreadful sort of pressure that everybody across the whole sort of system is sort of feeling. These things I just find inspiring. They give me hope. It shows what can be done when we work together to support each other. So thank you so much, Christian. Thank you so much, Alex. So I think we're pretty much bang on schedule. So I'm going to hand over now to our talking heads. I'm going to hear first from Rob, who's going to be talking about supporting parents who are key workers and how do you decide whether they are indeed key or not. So Rob, can you come online and give us your insights on that topic, please?
Yeah, okay. Hi, thanks, Mark. Hi, everyone. Hope you're all doing well in these strange times that we continue to live in. I don't know about you. I've been head since January 2019, and I feel like I've been doing it for about 20 years now. So, and I definitely feel like I've aged another 10 in the last 10 days as well. So, but we're all doing well at Saltaire and continuing to kind of move forward. So we're doing the best that we can. So yes, I've got the topic of supporting parents who are key workers and deciding who they are. So I'm just going to talk through what we've done really over the last 10 days in terms of managing the high number of children that we've seen. It's always quite strange talking about this because I know that I'm in a room full of highly experienced people. So I'm not here setting out what I think is the gold standard. I'm just sharing with you what we've done. And I will say I am very, very proud of what we have achieved so far. And I hope that we can maintain it in the weeks ahead. I know we're not unique as a school with a high number of key worker or critical worker children, but I do know as well that it's a really mixed picture, both across the authority and across the country. But we do have quite a lot, and so you know, we've kind of worked hard to try and make sure that we can balance everything out over the last 10 days or so. So just to give you a little bit of context about Saltaire Primary, we're a 2-form entry, and we're right in the heart really of Saltaire village, but the area that we serve is both children of Saltaire, but also of the wider Shipley area and Nabwood. And that area in itself attracts a lot of professionals who would be classed as critical workers who come and live and bring up their children in our area. So that is definitely, you know, that's definitely what we've seen in the last few weeks. And we knew from the first lockdown back in March that we would have an increased demand for places. But when we got that announcement last Monday night, we weren't quite sure who was going to walk through the door. But what I did know was that, you know, going by our experiences previously, I did know that there would be parents that would be absolutely desperate to get their children into school the next day. And that's because I know that we have a lot of teachers. We have quite a few head teachers who are parents. We've got a lot of NHS frontline and support workers, social care workers, test and trace workers, foster carers, the list goes on. And I'm sure you all have similar kind of experiences. But really, for me, it was really important that we were able to open in some way the next day for people who were desperate. So we kind of put out the message to say, if you had a place back in the summer, then continue to send those tomorrow. But please don't send anybody else until you've had confirmation from us. And so that was sort of the next 48 hours, really working through those critical workers. And that number, as I'm sure you've seen yourself, had increased quite substantially since the summer. So by the end of Tuesday, we had in the region of about 200 children who required places at school. So we've normally got 418. So obviously about 50% of our children actually wanted a place. About 157 of those were critical worker children, but then obviously because of the fact that we have quite a lot of foster carers, we have looked after children and so on, and obviously other vulnerabilities, that kind of pushed the number up quite high. So we set to work establishing our critical worker, the status of critical worker parents. And I think it was clear to us very early on that there weren't really parents that were pushing it. In our case, we very much felt that when we looked at the guidance and we looked at what we were allowed to kind of do, that the vast majority of our parents were actually, they required that place, and it was a very, very genuine need. But what we did change was the fact that in the first instance, we'd kind of set out saying we would have a full-time offer, because we felt that if children were going to get kind of sustained approach to learning, that it would be better that they're in school all the time. But what we realised quite quickly was that we weren't going to maintain that if we were going to have any hope of trying to keep the numbers a little bit more limited. So then what we had to do was start to work with parents to offer a part-time model. So we spent a lot of time even this week ringing parents, having discussions, and kind of going back to the guidance and kind of basically saying, is there any way of you kind of sticking to the guidance, and where you can keep your children at home? So that has pushed the numbers down, and I think we're probably at about 138, something like that, who require a place now, who are critical worker children, and they're coming on a either a part-time or a full-time, whatever they need, really. So that's kind of the journey that we've been on. But for me, it was always about trying to maintain the balance between the children who were at school and the children who were at home. Obviously, we've got literally half and half. And it was so important to me this time that the online offer was as robust as it possibly could be. But unfortunately, we weren't in a position where we could say, stay at home and have access to that. We've got to provide both. So what we've set up, I've got 5 minutes, I've just noticed, so I'm going to talk quickly now. We have one bubble per year group that has between 26 and 30 children in it. We have, but what we're doing is we are spreading the children out as much as we possibly can across 2 classrooms. So there's one teacher responsible for the learning, but we do have all of our support staff in school. So really, at the beginning of this week, it felt like a normal school, really, not felt like normal school times. 59 children, I think we put on our DFE return earlier in the week. But as we've kind of starting to work through it, we're starting to give the message that where you can work from home, obviously a lot more difficult for support staff. And just kind of maintaining that focus on the guidance, the fact that the government are saying that schools continue to be a relatively safe place in which to work, and obviously keeping that big focus on social distancing and hygiene. Definitely don't think we'll be able to maintain a 3-metre distance. That would be near impossible, I think. But I am pleased. I think it's been successful. It's working well. The offer to both key worker children and children at home, I think, is robust, and the staff are as happy as they can possibly be at the moment, notwithstanding certain anxieties around the number of children. But I do think we have, even with 50%, we've reduced the number of people that are walking out of their front doors every morning. So that's where we are, and my main worry is just how stretched we are if we do start to get positive cases in the weeks ahead, and how that affects things. But we're in a good place as it stands at the moment. I'll stop talking because I've gone 2 minutes over.
Thanks so much, Robert. So let's go on to Sarah now, who's going to be just giving us her insights into home learning support for everybody. So can I hand over to you, Sarah?
Yeah, hi everyone. I was given the heady title of Home Learning Support for All. What different this time? Lessons learned and how to support learning subjects that don't lend easily to home learning. I think we're all in that feeling of that. So obviously we've all had the DFE directive, and the massive main difference is that we're all expected to have our remote learning in place, and we're all expected now to have that policy and all have the a core of certainly for Key Stage 1 3 hours, Key Stage 2 4 hours a day, and Key Stage 3 and 4 5 hours a day. That's been a real challenge. The main differences are we have to teach a planned and well sequenced curriculum now, so that you're building on the good level of clarity, as well as having a digital platform. We're all expected to have a digital platform. And in a similar vein to Rob, I think I'll just talk through what we've done at Newby. So we took the decision quite early on, last year actually, to go down the Google Classroom route. So we're using Google Classrooms, but we also made a bit of a decision because of the area of need of where my school is. A significant proportion of my families have no tech. A significant proportion of my families have no Wi-Fi, and there's a significant language barrier. So we made the decision quite a long time ago to basically use the carry forward that the school had been accruing for a few years to buy tech. So last Thursday, we had a socially distanced pickup of tech, and we gave out every single family in our school tech. So that every single family has now the technology to get online. We gave out 300 devices, and we gave out dongles to families who had no Wi-Fi. That was a massive undertaking. And from that, we've set up our remote learning strategy, whereby we've had to timetable it so that Key Stage 1 and 2 children have different timetables for their remote learning, simply so that those families can all access it through a day if they're having to share that tech. That means that we've obviously had to provide packs of work. We made the decision not to give tech to our early years children. We're using a lot of the 50 things to do before year 5, as well as lots of activity based. We've also done a sort of a combined offer of pre-recorded and live content. So every child in Key Stage 1 this week has had a live phonics session, which is working really well in groups of 6, as well as a guided reading session. That comes more live next week with Key Stage 2 as well. It's been interesting. We've held clinics each morning where we could socially distance work with parents who are struggling with that tech, who have been coming in. But then we've also, so basically Key Stage 2 is all morning, and then what we've done is looked at our curriculum medium-term plans and then linked it for the wider curriculum to Oak Academy, simply because that is so much easier than us doing our own. So the children have their maths and their reading and writing, GPS or stroke live phonics, in a morning for Key Stage 2, and then the afternoon for Key Stage 1, and then we've wrapped around and done a plan around our wider curriculum through using Oak. So without a shadow of a doubt, the harder to do lessons such as music and things like that, we've utilised a lot of Oak resources on that as well. We've also done a whole school project. We felt that one of the things that worked really well for us in lockdown 1 was we'd set weekly projects that a whole family could do. So we've set a project this week on saving the planet, and we gave the families various aspects that they could look at, such as, you know, litter and plastic pollution, deforestation, and we gave them lots of sort of things to do. And each year group have a year group email that they can then forward their pictures or their videos or their writing to come in through that. So we've kept it a bit separate to the Google Classroom as well. But the main differences are, without a shadow of a doubt, the fact that the government have upped the ante and been, I think, in fairness, what they envisage, because obviously none of them really have ever had anything to do with schools, is that you are all in, and you have your critical workers in and your vulnerable children in while you teach them, and you just record yourself and the rest of them sit at home doing that. I think that's their view. I think that's where they think they're going. But the reality of that is very, very different indeed. So in terms of the appropriate use of subjects, we think the core is the most important to get going. The wider curriculum will have to catch up on more beyond the Oak, but I think that's the only way we can actually do it. So that's where we are. I've not taken the full 5 minutes because I end up boring myself. So hopefully that's been useful.
Super useful, Sarah. Thank you so much. So we're now going to hear from John, who's going to be talking about working with parents and parental communication during the new lockdown and harnessing lessons learned. So John, can I hand over to you?
Sorry about that. It wasn't unmuting for some reason. So firstly, I want to say a massive respect to our primary colleagues here, because the trouble that's gone on with the key worker stuff and the impact that's put onto your schools, I think, is massively challenging. Being the head of a secondary school, I look at it and sort of feel grateful at this period. And I stupidly decided to do the Ask School lateral flow meeting yesterday when my 4.5-year-old was doing a phonics lesson online. And wow. Yeah, I mean, if I thought our teachers had it tough doing live learning with 15, 16-year-olds, listening to a phonics lesson with 4 or 5-year-olds shouting out was a real lesson for me, and I'm definitely going to stick with older students. I think, you know, we've touched on some of this before, and it's again, you know, probably same as Rob and Sarah said. It's this is just our approach to communication, and we've been really clear about this, and it still backfires. Yeah, I mean, I read stuff on Facebook this week that I was sent saying how I'm being really, really harsh because I'm not providing vouchers and I'm providing these free school meal packs to parents. And we try and be as clear and transparent as possible, but we know we're not going to make everyone happy. The voucher scheme we knew was coming in, but we wanted to get out early. We got these big packs of food ready, but again, I knew they wouldn't be good enough for some of our parents. So it's just that you're always going to be in this situation. But for us, we always want to go clear and transparent and early with parents, so they know where they stand, and we try and give them that information. And we try and predict sometimes, as much as you can predict in this situation, what the government advice and guidance is. We like to go belt and braces approach. Obviously I serve a very diverse community with a number of different languages. So I'll write to them, we'll phone them, we'll text them, we tweet it, we put it on the website. So every piece of information goes out in sort of 4 or 5 different mediums, just so that everyone can have some sort of access to it. I'm fully aware that still doesn't make a difference sometimes, as I received 85 laptops the other week, and in the last 2 days, only 30 parents have come to pick the laptops up, and there seems to be communication issues. But our pastoral team are constantly on top of that, phoning parents and having those positive relationships. Our pastoral staff, which obviously in secondary we're fortunate to have in each group, phone every family twice a week. And I think the big lesson we learn is that we script the conversation. So the first question we ask is, how is the family? We ask then how the family are finding lockdown. Is there any issues or problems? From that point onwards, then we can gear the next questions, because if there's been issues and there's been a death, and at the end of the last term, we had, I think it was 10 families who had a parent or grandparent who lived in a home had passed away due to COVID. So we had significant impacts across the school. We just make sure we're having that conversation to understand where they're at, what the family's at. And then at that point, the year lead might turn around and say, do you know what? The work issue is not a priority at this time. And then they come back phone them back at a different sort of point. But we ask them those key questions, ask them if there's anything we need to about the young person, and then we speak to the young person. Obviously, for us in secondary, sometimes they're 15, 16 years old. It makes it very easy to have those conversations. But that approach that we have in school about a very personalised approach to learning and positive relationships, we've continued to develop while the students are online, and that's led to sort of their online learning. One of the big things I think we've tried to understand is really develop with our staff across this is really having empathy for parents and the struggles with online learning. Many of our young people will tell their parents they're doing really, really well, and they've done all the work set for them, and we'll come back and tell them they've hardly done anything. So what we learned from the first period is that we set remote learning first weeks. We go live lessons this week. The parents have had their timetables nice and early, so they get 2 core hours, 1 foundation subject hour, and then they get independent learning tasks on top of that. But we tell the parents what to expect, how much to expect. But we're going to write to them at week 4, where we rag rate the student progress. As much as that's an additional task for staff, our staff loved it, because the engagement levels after our last rag rating in the last lockdown went up by about 60-70% after we'd rag rated to parents, because they got the idea of the traffic lighting system. So it became really, really easy for them. Everything for us is about building those positive relationships with the family, keep checking up on the family and talking about the wider family and seeing how they're doing. But it's hard because we're having so many phone calls, and sometimes they feel like they're just trying to get you off the line. But it is about those relationships all the time, and keeping that going and keeping our young people going. The level of work from our young people was brilliant. After the first lockdown and we came back, the standards, what they produce back into the academy is really good. We produce a video to students and parents. My videos going out tomorrow morning, and we're quite direct with them this time. We have a lot about accountability, and if students aren't engaging, we haven't got massive numbers in our building. We've still got BTEC examinations going on, and we've had those students in, but we're if students aren't engaging, we're working with the families and we're bringing them back into school. So it's a punishment to come to school for our young people quite a bit, because it means they're not being independent in their learning. And that was the one big focus for us. When we came into the academy about 18, 19 months ago, there was no independence. We've gradually brought a real independence into their learning, so they're taking responsibility for it. But it still revolves about us driving that, and that's sort of our transition. And we're trying to use our remote learning with our parents now to drive that into independent work for young people. But it is a challenge, especially with this situation with round of year 11. Gavin Williamson was brilliant this week. You're not doing exams, but you might do exams. So that's been really helpful for us. But our young people are engaged. We have held online assemblies with them and their parents, educating their parents, because we know most of ours won't watch British news and might not be up to date with it. And it's just keeping that communication going. So that's what we're doing here at University Academy Keighley. Fantastic.
Thanks to the vote, John. So I always wondered who votes for Trump, but I also wondered who the 8% of teachers were who thought that Gavin Williamson shouldn't resign. So, thank you so much. We're going to hand over now to Lynette, who's going to tackle 2 items for us. So one, she's going to talk about supporting staff well-being, both in school and at home. But Lynette also is going to kindly cover our item on supporting vulnerable families during lockdown. So Lynette, can I hand over to you, please?
Thanks, Mark. Good evening, everyone. I have just decided that I've had my 14-day trial experience of 2021 and I'm done. I'd like my money back, and let's just fast forward a little bit. It's just all too much right now. Supporting staff wellbeing at home and at school, I'm never convinced that that's something that we do get right. And I guess part of that is probably down to, you know, everybody has an opinion, don't they, on how you should be doing something, and whether it's the right thing to do. And that's very difficult, particularly at the moment, because we're working in such an emotive situation. You know, one thing that we do regularly that supports our approach is staff surveys. We might, depending on the situation, how things were going. Before Christmas, we've moved to doing them probably every 3 weeks, and that was providing us with great feedback around well-being and staff opinion, and you know, and ideas and solutions to things we were experiencing. But we are going back to doing that weekly at the moment. Somebody put on some feedback that they thought I was putting the children before the staff, and that wasn't fair. To which my response was a little bit of a giggle of, yeah, because that is what we do as professionals right now. And that, you know, there's a lot of work there to be done around mindset with some of the staff that straight away thought lockdown would mean we are back at home. I think a problem that we've really had is, I guess, something that Sarah touched on, really, that lockdown version 3 is very different to lockdown version 1, in that staff were at home. We at Grove House, we functioned from the Hanson Academy hub, and at Crossley Hall, that was a hub that supported other children and other schools as well. But the expectation this time is incredibly different, especially around the expectation around learning, around supporting children with EHCPs and still focusing on those EHCP outcomes, and the definition of vulnerable as well. And a lot of our staff wellbeing approach has really been helping staff understand that and why it's different and why lockdown is different now. I do think that Boris's announcement, which of course was only last week, kind of brought a impending doom over us, in that, you know, we've done lockdown once, we know what it was like, we know what it felt like, and it wasn't very nice. And the fact that you've got to do it again now has just brought us right back into that really dark place, really. We have a lot of kind of standard things that we offer. Hayes Recruitment offered us a wellbeing package, which we used in the first lockdown, which we can tap into again. We have lots of things set up already in school, our existing systems around WhatsApp groups, Google Meets, checking in on each other, making sure everybody's okay. I've had staff this time come to me and say, "And are you okay?" And that was something I didn't experience before. And I've actually stopped with my standard answer of, "Yeah, I'm fine," because actually I'm okay, but it's hard, and it's important that I'm honest with staff and I model the honesty of how hard I'm finding it to support them as well. I think the most important thing, and I've probably said this on every Zoom that we've had together, is the relationships, and taking the time to listen to staff and what they've got to say, whether actually it's an opinion that you can do something with, or a solution you can do something with, or simply just taking the time to listen to them, and just some compassion and understanding where you can. It's identifying those staff that are at the point burnout, and they just need to take a deep breath, because that, to get as a teacher, you keep going, you keep going, you keep going, and it is really when you get to that crisis point, that burnout point, that it kind of all collapses for you. And it's identifying that before it gets to that point. I talk a lot. That's just me, it's who I am. So talking a lot to staff in teams. We have masks inside the building now, so I have wandered around more and checked in with people more and been present more, and I feel comfortable in doing that. For my own safety, I have been going for the lateral flow tests at St George's Hall, which I have to say, I think Bradford Council have done a fantastic job of putting that on. It's very well organised and run, so I just feel more comfortable in looking after myself in that way. But it's been really helpful to be able to speak face to face with staff. I think the most powerful offer is that's around has come from Christian, and the Birth to 19 offer around wellbeing, and our staff have accessed that. I've sent that on to our business partners and heads so that they have details of it as well, and can be more proactive in who they are identifying. And we had someone that was at that crisis point and had support within 24 hours, and it was just phenomenal. We would not have had that given any other circumstances, and if this support hadn't been available. So I think really my thoughts really around staff wellbeing are knowing your staff, being proactive, and plenty of talk. And whether it is opportunities to give anonymous feedback or an anonymous system for how you're doing things and how they're feeling, or encouraging them to put their names to things so that you can go and unpick in a little bit more detail. If I move on to our vulnerable children and just make a link there, that again, it is about the relationships with the children and families for us. We don't actually have a behaviour policy in our schools, and in any of the Pennine schools. Our approach is a relationships approach, and it's been really powerful, and it's been a real shift for us. But it has been a key element of support through this whole pandemic. Obviously, we've got the children in school. At Crossley in school, we've got around 80 children at the moment. It's growing. We're in the same position of everyone else in terms of controlling those numbers at the moment. And we've got a similar number at Grove House as well. Knowing the children, as I say, everybody gets a weekly phone call standard, but now because our online, our remote learning offer is so much better, we've got the added extra of Google Meets with children. So we do a morning check-in with them. So straight away you can set up the day and identify actually who needs a follow-up call or who didn't quite see themselves today, and you can follow up on that straight away. And we track that. We have like a master spreadsheet of how we track that information. On top of that, we've got garden visits. Our attendance officer is shielding, so I have enlisted the support of BCL, who deal with attendance at Grove House, but not at Crossley Hall, and they're picking up our garden visits for us, just to go and stand in the garden, obviously socially distanced and very safe, just to see children, check in with parents. We're very aware that some of our parents at home are at home alone with their children and have no adult conversation at all, which is very difficult. And so Graham, who does our visits, has been absolutely fantastic. And he also supports families, which has a knock-on effect for those vulnerable children in terms of benefit support, what they can access and what's out there at the moment. We've had fantastic feedback there. Again, through Birth to 19, we had got the support of Step 2 and a counselling service for children. They'd been in both schools a day a week since November, and they are now offering remote support, but they're offering to work with families and children at home, so they can do that remotely or telephone support to parents. So it's really good we've got that level of expertise there. For our vulnerable children, really, and when I'm using the term vulnerable, I'm thinking more about not just children that have social workers, but children that we know are vulnerable in our community in one way or another. For Key Stage 2, we really focus on making sure we're speaking to the child, and the child gets a chance to speak to their teacher or Google Meet with their teacher. And for Key Stage 2, it's a bit of a combination of the both. We're probably finding our feet a bit at the moment. We've had a couple of parents say, oh, this is the 5th time you've rung me today, because everybody's in a bit of that crisis mode of trying to do everything. And, you know, have you picked up your food hamper? Have you got your learning pack? But we're finding our feet with that, and that I'm sure that will settle down. I think it's about swift identification where there is an issue. We have an electronic referral service that goes to our pastoral team to pick up, which is something new and effective. We've got 2 very experienced designated safeguarding leads in schools, so we've got their expertise to tap into. All our teaching assistants are in the process of being mental health first aid trained, so we're building our skills base there as well. And we will take on board any ideas that staff and people have of, actually, I think this child needs that, and where cases warrant it, just putting together a more bespoke offer for a child or a family where it's needed. I think we're, you know, we've done this once. This is a marathon, not a sprint. I don't feel hopeful that schools will be back to normal or back open after February half term. And I think we need to be realistic around that, my one thing I tell them to really hang on to is that moment that we're all in the hall and we all say good morning to each other, and it's just going to be absolute magic. And I'm sure there will be tears and hugs all around. So we will get there. If I can answer any questions, I'm willing to answer questions, but just keep going. Thanks, Mark.
Thank you, Lynette. Absolutely brilliant words, such wise sort of words. I think, you know, like Duncan and John said, we just got to weather this out. It's going to take sort of a bit of time, but it will be amazing when we get to the other side of it. Unfortunately, we're going to have that whole recovery phase, because it's going to take years for us to you know, really start helping the children recover and helping the sort of schools recover. But there's also opportunities that come with that, so we'll seize those opportunities. So just before the breakout groups, Beth's just going to give us a quick overview of harnessing new technologies, and we'll give everybody the chance to have a sort of discussion about some of these issues within their groups. So Beth, can I ask you just to quickly talk to us about harnessing new technology?
Yeah, hi everybody. It's a very grand title, that, really, harnessing new technology. I wasn't even sure what it meant myself at first, so I'm just going to talk about what we've done in specials at Hazelbeck, really. So it's looking at it from a special school perspective. Obviously, we are fully open at the moment, but we've got many families who aren't in school, so that use of technology is still really important for lots of our families. But for many of our families, using it just as a platform or as a Zoom meeting doesn't really work for them. So it's being around having lots of conversations with families about how we can best help them to access learning. What we've found for a lot of families is that actually they need more practical activities. So we've had lots of drop-offs of that, and then being able to use the videos to help parents to understand how to use that activity, so almost model how to use them. So that might be using hand under hand, or how they might interact with their child with certain activities. We've used it to demonstrate how to use now and next boards, different communication methods that might be being used. So people have done signing videos. So we've used it in different ways around that to be able to model. It's had to look very different how we've used it for different young people, very much based on each individual's needs. So there's not really a group way in which I think we can say that we've harnessed it. People have had to be creative in the way that they have used it to meet the needs of those different groups. We've been able to use some more live streaming kind of things to be able to get young people sometimes to do actual lessons, but quite often to have more of a PSHE focus. So they're still actually having those contacts and can create that maintain some of those social aspects that they otherwise lose out on. And that's been really important for a number of our groups. For some of our groups, that's not something that is important at all, and actually trying to get them in front of technology is not the right thing for them at all. So it's actually being able to look at each individual and working out how that works. We have been able to continue to use evidence for learning. and it's a great platform that means that actually it's allowing our students to generalise their EHCP intentions at home, so we actually get to continue to focus on that, but actually it builds the progress for them because they're not just doing it in the one setting. So we're actually really being able to look at how we can see that generalisation of skills for young people, and it's a great way for us to really be able to focus on that with parents at the moment. We've held some webinars for parents to help them to understand how to use that better, made sure that they've got iPads and things at home, or devices, so that they can access it as well. We were sent quite a lot of laptops from the council at first, but they were great in changing them if they weren't the right device for our young people, and actually an iPad would be better, so that was really useful to be able to change, so we had the appropriate device for our students. So yeah, I think really in terms of harnessing technology for us and for young people with additional needs, it's very much looking at each individual, working with the families as to what's going to work best for them, and then trying to use it in whatever way to be able to build on that progress towards EHCP intentions, so that they're still making that progress, but we can actually see that lateral generalisation more for young people at the moment. Okay, thank you.
Super, thank you, Beth. That's great. Really, insightful. I'm being inarticulate, so I'm going to read out what Ruth Dennis sort of said. So here we go. So a brilliant senior educational psychologist is saying that she's in awe of the amazing provision schools have developed in so many different domains. Thank you. Brilliant words from Ruth. So we've got a bit of time for our breakout groups. We'll probably just keep it to sort of 10 minutes for people just to chat, just to share with each other. Feel free to discuss whatever you want to discuss. But if we can ask everybody in their groups to think about a topic for our head teachers to talk about next sort of time. So Katie's going to do her magic, put us all in our breakout groups, and then we'll reconvene in 10 minutes sort of time. Have a great discussion, but please do think about the topics for the next time we meet. I'm sure everybody's had really productive conversations in their breakout rooms. Huge thank you to everybody for who's sort of spoken. Huge thank you to everybody for coming and sort of contributing. We really would like sort of people's sort of suggestions for talks next day, but maybe if people can just put them in the chat and we'll sort of harvest them from there. So if any breakout group decided what they'd like to hear our head teachers talk about next time, you can put that in the chat and we'll compile it. A reminder for everybody that the next webinar is on the 11th of February. So we'll be sending out email reminders. I don't know where the 2 hours go. They're just phenomenal events. I think I learned so much. Ruth and I had a quick exchange just about how inspirational all of you are. There's just not enough recognition of the incredible work that every sort of teacher and every head is doing, not just in this sort of district, but sort of nationally. And we remain committed. I did promote just what incredible work was happening by you all in a Radio 4 program, which I think went out today. So hopefully we're getting the message out there. But anyway, who cares about them? What really matters is that everybody on this group is supporting each other, pulling in the health services, and we all work together to get everybody through these tough sort of times. So Christian, you've got a couple of things going up there. Do you just want to quickly sort of say something? I'm not quite sure what that means about input from teachers' unions.
Purely, it was we had a colleague there from the NEU just to say that they're getting different concerns. Nothing, I think, that was just running hugely controversial to the topics we're talking about this evening, but just an opportunity for them to be able to talk about some of the messages that are coming through directly through to the professional associations from school staff, just in terms of COVID response. I just think it'll be an interesting perspective. It's an open forum here. That was that.
Brilliant. Okay, well, thank you, sort of Christian. Thank you to all of our speakers. I think we'll call it a night there. I've got to try and get from Bradford Royal Infirmary back to Ilkley, which is going to be challenging. So I'm going to wish everybody a good night. Put on my snowshoes and head off into the white sort of wilderness. So wish me luck. I hope everybody else is safely sort of tucked up at home. Really looking forward to seeing everybody on February 11th. We will be circulating materials. Any questions in the meantime, do let us know. Any ideas for things that you'd like to hear the head teachers talk about in the next session, please do put them in this sort of a chat. But I'm going to say good night now to everybody. Huge thank you again to everybody on this sort of a call. See you on the 11th. Bye-bye.